ليش يا زلمه؟ كان عم
His Grace Bishop of Bath, because he's overseas.
مساء الخير بضيوفنا الكرام واهلا وسهلا. حللتم اهلا ووضعتم سهلا. يسعدني ان ارحب بسعاده النائب اللبناني ايهاب مطر، الاب مايكل سندوسي ممثلا سياده المطران أنطوان شاربل كرباي راعي الكنيسه المارونيه في استراليا ونيوزيلندا واوكيانيا، السيد مايكل رزق ممثلا سياده المطران روبير رباط راعي ابرشيه استراليا ونيوزيلندا للروم الملكيين الكاثوليك، قدس الاب الاشمندريت افران ممثلا سياده المطران باسيليوس قدسيه متروبوليت استراليا نيوزيلندا والفلبين الروم الارثوذكس، الدكتور غسان شربل، الاحزاب اللبنانيه، القوات اللبنانيه، الكتائب، التيار الوطني، المردة، حركه الاستقلال الاحرار، جمعيه الاطباء الاستراليين اللبنانيين المان، الرابطه المارونيه في استراليا، التجمع المسيحي الاسترالي اللبناني، مؤسسة الانتشار الماروني، مؤسسة سيدر ووتش لحقوق الإنسان، التجمع الماروني الأسترالي، غرفة التجارة الإسرائيلية اللبنانية، الكهنة الأجلاء والراهبات الأفاضل، Ladies of the Gospel، الجمعيات اللبنانيين، الإعلاميين من وسائل الإعلام المرئي والمسموع والمقروء والإلكتروني، كانتربري بانكستاون لاينز كلاب، مجلس 17 تشرين. يسعدني أيضاً أن أرحب بأهل البيت، الجامعة اللبنانية الثقافية فرع سيدني، وترحيب كبير لوفد الجامعة اللبنانية الثقافية فرع ملبورن، الذين تحملوا مشقات السفر وحضروا خصيصاً إلى سيدني ليشاركونا في هذا اللقاء، وأهلاً وسهلاً بالأصدقاء الأعزاء. أيها الحضور الكريم، سيداتي وسادتي، أهلاً وسهلاً بكم جميعاً فرداً فرداً. تحية خالصة من القلب، وأشكركم باسمي وباسم رئيس المجلس القاري للجامعة اللبنانية الثقافية في العالم لأستراليا ونيوزيلندا الشيخ جو عبيدة، وباسم الهيئة التنفيذية لحضوركم هذا اللقاء ولاهتمامكم في المشاركة في هذه المحاضرة الطبية التوعوية بعنوان اكتشف أسرار القلب، التي سيلقيها الدكتور غسان شربل، طبيب اختصاص أمراض القلب والأوعية الدموية ومؤسس هارت كير انستيتيوت والرئيس السابق لجمعية الأطباء الأستراليين اللبنانيين أيضاً. لذا دعينا إلى لقاء من القلب إلى القلب. حضوركم يسعدنا، ومشاركتكم سوف تساهم في نشر الوعي الصحي، مما يؤدي إلى خلق مجتمع سليم ومتوافي. وشكر كبير لسيادة المطران باسيليوس قدسية لأنه استقبلنا بهالصرح الكريم. شكرا جزيلا. جرت العادة إنه تتناول الجامعة اللبنانية الثقافية مواضيع وطنية لبنانية بحتة تتعلق بوطننا الأم لبنان يلي ما بتخلص مشاكله وشجونه، ولكن الجامعة اللبنانية بما أنه اسم على مسمى الجامعة اللبنانية الثقافية، حبينا أنه نتناول هالمرة مواضيع ثقافية علمية. لذا أخذنا مبادرة فريدة من نوعها بتنظيم محاضرة طبية توعوية إيمانا منا بضرورة الإرشاد والتوعية لما فيه صحة الإنسان وخيره، فالصحة تاج على رؤوس الناس الأصحاء لا يراه إلا المرضى. شاءت الظروف أنه طلب مني أقدم هذه الأمسية الجميلة كمسؤولة الإعلام في الجامعة اللبنانية الثقافية، وشاءت الصدف أيضاً أنه الطبيب اللي اختاروه الرئيس والأعضاء مجتمعين لإلقاء المحاضرة يكون الدكتور غسان شربل اللي بيكون خيي العزيز واللي بعتز فيه دائما متميز ومتفوق منذ المقاعد الدراسية. اليوم رح نحكي صحة. ليش صحة؟ لأنه الصحة هي أعظم نعمة للإنسان، وما بتتمن بكنوز الدنيا كلها، هي الثروة الحقيقية، ولا شيء بيساوي الصحة والعافية لا المال ولا الجاه. من يملك الصحة يملك الأمل، ومن يملك الأمل يملك كل شيء. وأجمل ما قيل في الصحة مثل بحبه كثير: الصحة حصان، إما أن تنطلق به وإما أن ينطلق بك. من هون أهمية الإنسان يحافظ على صحته. وقع اختيار موضوع المحاضرة الطبية على القلب. ليش القلب؟ لأنه القلب أهم عضو بجسم الإنسان. القلب يلي بحجم كف اليد هو يلي بضخ دم لكل أعضاء الجسم، هو يلي بيعمل بدون كلل ولا توقف. طول ما القلب عم ينبض، طول ما الإنسان حي يرزق، وبس يوقف القلب بينتهي الإنسان. وتعد أمراض القلب هي السبب الرئيسي الأول للوفيات حول العالم. مين منا ما خسر حدا من عائلته بمرض القلب أو بسكتة قلبية من محبينه؟ ومين منا ما بيعرف هالمقولة المشهورة: درهم وقاية خير من أمطار علاج؟ من هون الضرورة المحافظة على قلب سليم. كيف بدنا نحافظ على صحة قلبنا؟ هون بدنا نسأل الدكتور غسان شربل الموجود معنا تنستفيد من مهنته، من مسيرته المهنية الطويلة والإنسانية. هو اللي قدم مساهمات كبيرة بمجال أمراض القلب من خلال أبحاثه ومنشوراته برعاية المرضى. رح يشرح لنا اليوم عوامل الخطر المؤدية لأمراض القلب والشرايين والوقاية منها، وأهمية إجراء الفحوصات الطبية الدورية. دكتور غسان شربل، منبر لك، تفضل.
في هالسيارة في YDK double 2 and numeric blocking the driveway here. People need to get out. So please, if it's your car, move it. Thank you. شكرا.
First, I would like to say thanks for the invitation tonight, and big thanks to Sheikh Joe, WLCU, and all the board members who worked very hard to organize the night tonight, the talk tonight. All right. When they asked me to present a talk about the heart, I got quite excited because the heart is actually a topic very close to my heart. I find it very interesting. Maybe I'm biased, but I find it to be the most interesting organ in the human body. The heart, basically, if there's no heart beating, as my sister mentioned, basically there's nothing else going on in the rest of the human being. Now, preparing the talk, I didn't want to have slides and just text after text and make you bored and fall half asleep like halfway through the talk. I tried to make it quite interesting. It's going to be interactive, so at any time, just ask a question, raise your hand. I'm free to ask questions. If you want me to say anything in Arabic, by all means, ask me. I'm happy to translate what I said in Arabic, but of course, not the whole talk. And by the end of the night, if you leave the room remembering one or two things about the heart, I'll be quite happy, because that information that you might remember might save your lives or anybody else in your family members. So I hope that you gain something from it. And also, I would like to thank you all for coming tonight. I know it's been a long night. Probably some of you haven't been home yet. So thank you all for coming. So I'm going to start by standard things we do usually when we give presentation about the talk, is a statistic. What actually, sorry, I like to move you when I talk. Okay. Bit of statistic to start with. Cardiovascular disease comprise heart disease, strokes, and peripheral vascular disease, blockage artery in the hearts, the legs, and the rest of the body. So a combination of those three diseases are the world's and Australia's #1 killer. Every 18 minutes, one Australian actually dies from cardiovascular disease. That equates to about 79 deaths every single day. So it's a very big disease. It has big burden on our health budget as well, plus the well-being of people and their family. Over 6% of Australians adults have one or more cardiovascular disease. They could have a combination of heart attacks, heart diseases, stroke, and so on. It's not just one. And that's about 1.2 million people in Australia. So basically, equivalent to 1 in every 20 Australian is affected somehow by that disease. In 2020, about 57 people in Australia aged 25 and over, and I emphasize 25 and over because we have seen lots of young people having heart diseases, have had heart attack at some stage or unstable angina. Unstable angina, like it's people developing disease that will lead to heart attack down the track, which is around 155 every single day, and 12% of those people actually they will die by the end of the day. And the number of people suffering those diseases are increasing every year, and that's due to the changes in our lifestyle, especially obesity and diabetes, which are the major risk factors for cardiovascular disease. Now let's go down to business. Heart diseases. It's not just heart attack. It's a group of variety of diseases that can happen to male, female, old, young, newborn even. But I won't be talking about everything because I'll be spending days and days talking about it. So I will try to be as brief and as common knowledge to everybody so you remember. Heart attack, I will be talking about a bit more in details because that was most likely the more important topic of the night. But there are other heart diseases, not just heart attack. Angina. Angina means people are developing blockage in their arteries of their heart, but not bad enough to cause heart attack. But people with angina, they will be developing symptoms such as short of breath when going uphill activities, doing exercises, or any kind of movement that develop angina. And those people need to be looked after very carefully because that will lead to a heart attack down the track. Heart failure. Heart failure basically is like in Arabic, تضخم بالقلب. So basically, the heart can be enlarged and quite weak. So rather than normal heart pumping like that, the heart failure heart pump like that. And some patient actually, when I look at the test that we're doing for them in my rooms, I look at the test, I look at the patient, is he breathing? Is he not breathing? Because the heart is barely moving. And that's what heart failure is. And heart failure is going to be quite big burden on the health system because those people present to the hospital quite frequently. And they usually have very short prognosis. They're usually dead by 3 to 5 years, unless they are treated very well with the right medications. And with the heart diseases can be many reasons. It can be blocked arteries, like heart attack leading to heart failure, or it can be just a virus. Some people have just chest infection. The virus attack their heart muscle, and it makes it quite weak. And then usually we have to put them on specific medications and keep watching them to make sure they get better. And the worst case scenario of heart failure, especially in young people, they end up needing heart transplant. Now with valvular disease, probably next slide. It's basically this anatomy inside the heart. Next one. Yeah. It's in, are these, no, sorry, go back, sorry. Yeah. So basically, sorry, I don't have the pointer. So these are the valves inside the heart. These are the chamber where they pump the blood in and out of the heart. And it's not just, as I said, heart attack or heart failure. People sometimes come with valvular disease. It can be either blockage or calcified valve, quite tight, so the blood is struggling to get out of the heart or going inside the heart, or it can be leakage valve. Some people like a murmur or summam عم بيروح. That's what that means, leakage valve. That means rather than all the blood's going in one way, and the valve closes, actually there's a big gap between the leaflets of the valve and the blood comes back. So, and that if that becomes quite severe, patients becomes quite sick from it, short of breath, chest pain, and they need to be either repaired or have surgery. Or if they are too frail to have any intervention, unfortunately they will end up dying. Now, arrhythmias, if you compare to the heart attack is like the plumbing of the heart. Arrhythmia is the electricity of the heart. Arrhythmias are basically how the heart pump and how the rhythm of the heart. And the normal simple heart rhythm, you can show the next one, please. That's the top one, that's a normal ECG. What we just put some dots, usually when you go to the hospital, and then we do that. And that will tell us lots of information. That ECG we don't want to see. It gives us very, very anxious time. That's what's correct. No. Sorry, this one. Yep. That ECG, if patient stays in that rhythm for a long time, they drop dead. Very simple. And then people with heart failure are at high increase of this kind of rhythm. And then when we do the ultrasound on the heart failure patients, we look at the pumping capacity. The normal capacity is about 55% and above. That's considered normal. When that pumping capacity drops below 30%, people are at high risk of developing arrhythmias such as that. So those people will require a defibrillator, because defibrillator is like a pacemaker, but has electricity in it. It basically sit there and watch. When rhythm like this happen, the patient might actually collapse and die. What does the defibrillator do before the patient actually dies? It will shock them and then bring them back to normal life. I'm going to show an interesting video. The next one, sorry. Don't play yet. Sorry. So that's this professional soccer player. He has problem with his heart, and he has a bit of heart failure. So this guy, they had to put defibrillator because he's at high rhythm, at a high risk of developing that dangerous rhythm that we see. So basically, we don't know when this rhythm is going to happen. It can happen in 1 day, 10 years, 20 years, but we don't want to take the risk of this happening without protection, because if it happens, the patient will die. Now, if you watch the soccer player, he has that defibrillator inserted, and then you will see him actually is walking, he will fall, and then you will see his legs shaking. That's because the defibrillator has actually kicked and shocked him and brought him back to life. Can you play that, please? From the beginning, probably. Oh, there's no video. Oh, no video of that. I can see it here. Maybe go back and. That doesn't work, yeah? Oh, okay, try that. Sorry, just start from the beginning. Okay, so that's the play you watch. So basically, he'll be dead if there wasn't, and then you see his legs are shaking. That's a different bet. Actually, had shocked him. Look, and he just stood up now. But nothing has happened, and he wants to play again, but that took him out of the field, of course. So, if it wasn't for that defibrillator, basically that person would have been dead by now. So this defibrillator is quite important, and that's why we look at all the arrhythmias, the funny rhythm, and the heart failure. It's gonna go back. Just have to stop it a little bit. You can go back one slide. Okay. Now, also we have what's called congenital heart disease. It means people are born with this kind of diseases, either inherited from their family, or there are something lifestyle changes happen that when they were born, it caused a problem. The first one is quite common. That's called the aortic valve. It's the main valve that heart pumps the blood through that valve to the rest of the body. That's the normal heart valve. It has like the Mercedes sign, 3. The congenital one, when they come, 2 valve, two leaflets. So just straight line. And we see lots of young people in their 20s and 30s coming to my room with this kind of valve. And actually, I had a patient, he's only 42. He's very fit, athletic. He runs 15, 20 kilometers every week. One day, he woke up at night, bit of palpitations. And then he went to bed. His wife was concerned. Go see Dr. Charbel, because I looked after her father. And then he said, okay, I'll go. He kept delaying the thing. And one day he came to see me. And he was completely fit, healthy, no symptoms whatsoever. I did ultrasound on him, and he had that valve with significant regurgitation, significant leakage valve. So basically, within 2 weeks, ended up having surgery, and he replaced that valve. Lucky that he came, because at the moment, maybe because he's quite fit, maybe that's why he wasn't getting much symptoms. But if he kept going, definitely his heart becomes quite big, because the heart have to compensate with this overload of keep pushing too much blood through that valve, and he developed heart failure. So lucky he came, we fixed him before any damage done to the heart. So you don't have to be just old to have heart problem. You can be as young as 20, 30, even 15, or even newborn these days with congenital. But being an adult cardiologist, we only looked after patients 16 years and over. And also, there are different type of valves. There are the walls between the heart chambers can have a hole between them. So blood can go from one chamber to another rather than that being closed and going one area. The bottom chamber of the heart can have holes in them. And that's a normal arteries that can be swapped. And these need surgery usually at younger age. So lots of diseases, and usually happen, that's for the young people. And some of those diseases, like that valve, that runs in the family. So when the patients come to us with that kind of valve, we tell them that his kids, the brothers and sisters, and their kids need to be screened for it because there's a good chance they might have it as well. Go back on slide, sorry. One more. Okay. Now also there's the stress-induced heart attack, which is a broken heart, we call it. That's usually happen if someone's cat died suddenly, some like big death in the family, or like a big major event happened in their life. They present to the hospital with the typical heart attack symptoms: chest pain, short of breath, blood test for the heart's quite high. But when you do the angiogram, actually the arteries are pretty clean. There's nothing going on. But the ultrasound showed that the main chamber of the heart is ballooning, and that's usually because of the stress. These people have good prognosis because we put them on medications for the heart, and then within a few months back to normal. But it is actually a disease, and it's actually well known now, called broken heart. Next one. Okay, now let's go down to business. What is a heart attack? There's difference between heart attack and cardiac arrest. To start with, cardiac arrest is actually when the heart arrests, stops beating, so stops. Like this guy who fell on the ground, that's called cardiac arrest. Heart attack is the heart still beating, but there's not getting enough blood supply to an area of the heart where that artery supplies. That the heart, and then usually it's, as I said, the plumbing of the heart, so all those vessels. Now the heart is a bag of muscle, pumps blood to every organ of the body. But the heart itself needs blood supply as well to survive, otherwise they'll die. So they have their own blood supply through those arteries. That's on the right, and that's the middle one. Probably you heard the word widowmaker. That is the widowmaker arteries. If that blocks, there's a high chance people can have arrhythmias, like I showed you before, and patient actually can drop from that. So an area of that artery blocked, not enough blood coming to a certain area, and people will develop symptoms. We'll talk about symptoms shortly. And that's because the lack of oxygen getting to that area of the heart. And the longer we ignore the symptoms, if somebody is having a heart attack, the worse the prognosis and the more complications, because the heart cells will start to die and become irreversible. The sooner we can deal with it, the sooner actually can that cell revive again and survive. So basically, that's an area of the heart not getting enough blood supply. You could see it's getting on the dark because it's not getting enough oxygen. And that's the arteries of the heart when actually a heart attack occurs. That, to start with, is the plaque. That's what we call stenosis or blocked artery. Can be 30%, 40%, 50%. Now, when the heart attack occurs, that blockage, say like 50%, for example, suddenly becomes 100%. Not slowly develop 50, 60, 70, 80. That's called angina. Heart attack is one small blockage, become 100% all of a sudden. And usually that occurs because if you could see that cap around that's cholesterol deposit, and that's the cap. That's why sometimes we put patients on cholesterol tablet, because the cholesterol tablet can stabilize that plaque. Once that plaque becomes vulnerable and ruptures, clot, because blood coming through the arteries, a clot can form because it will expose the cholesterol, and cholesterol is a foreign body. So when that is exposed to the artery, clot can form suddenly, 100% blockage, heart attack. And then if not treated urgently, as I mentioned, become this area wherever that artery is supplying, it can die actually and can cause problems. If it's that vessel, it will be this area. So each vessel has different part of the heart, supplying different part of the heart. Now, symptoms of heart attack. These are textbook description. Pain or pressure in the chest, or as we know, blata asadri. Pain or discomfort in the arms, mostly on the left side. and go up to the jaw or goes to the back. People develop shortness of breath because the heart is not pumping very well, not sending blood to that area and oxygen, become quite short of breath. Also, if the heart attack is bad enough, can cause bit of fluid on the lungs. You can become nauseous, you can be quite fatigued, feel tired, dizzy or lightheaded, and you can be sweaty with the pain. Depending how severe the heart attack is, the worse the symptoms. Now, having said that, not all heart attacks are the same. I had patients having heart pain on part of the elbow here, and actually it was a heart attack. I had patients coming to me with the test, actually they had heart attack in the past, but they never knew about it. That's because, especially those people have diabetes, because people with diabetes, that cause damage to their nerve ending, and then because of this, they don't feel the pain. Doesn't mean they didn't have the pain. They had something, but they couldn't feel it because they cannot feel pain because of the nerve ending. So heart attack can be in any shape or form, basically. So if at any stage you have symptoms that you are concerned, at least go to your family doctor if you don't want to go to the hospital or call the ambulance. Just go to the doctor because the doctor can do at least an ECG to start with, and then he will say, look, that's fine, go to see the doctor at some stage, or not go to the hospital. So next one. And as I said, the warning signs differ from person to person. People can have like a bit of discomfort in the throat that can be heart attack. And people who develop heart attack are at increased risk of having another one because they're already at high risk of developing one heart attack. They're at high risk of developing another one because they usually have lots of risk factors leading to that, which we'll talk about that shortly. Now, our main talk of the night is the heart attack and how to recognize it, what to do about it, how to treat it in a way, and how to prevent it is the most important thing. The main part of my job is preventative cardiology, is try to look after patients, try to treat their risk factors and hopefully prevent them from having a heart attack, rather than having a heart attack and then they come to me and see them. Of course, I see those patients, but so better prevent it from happening and then treat it. Next one. Now, what to do? The most important thing is just don't panic and try to recognize that something is going on, especially if you don't feel comfortable, even though you're 30, 40, 50 years of age. Never say, no, I'm not going to have a heart attack. It's not going to happen to me. I'm not going to be the one, because it doesn't discriminate. No matter you are woman, man, black, white, any race, and some races actually have more risk of developing heart disease than others, like Indian, Pacific Islands, and so on, are more risk of developing heart diseases. So the most important is just to stop whatever you're doing, because if you put more strain on yourself by continuing exercising, you are making things worse. So try to stop, tell somebody that you're not feeling the best, and the most important thing is to call 000. As I said, heart attacks are an emergency, basically, because every minute counts. Every minute you delay the treatment, the more heart cells will die. The more heart cells will die, the more of your chance having heart failure. And now they recognize it for the last few years. If somebody's having a heart attack and the ambulance comes and they do an ECG, no, sorry, that's fine, that's okay. And they do an ECG and that confirms that having an acute heart attack. In the past, we used to take them to emergency, do the ECG, blood test, call the cardiologist, get the cath lab organized and so on, and get them to cath lab. Now, what we are doing at the moment, if the ambulance comes, somebody's having a heart attack on the spot, with the ECG by the ambulance offices, they will contact the closest hospital that they do have a cath lab. They contact the cardiologist directly, they bypass emergency. The patients go straight from the ambulance to the cath lab. And while in the cath lab, the cardiologist would have been notified on the way, so he'll be there, the nurse is there, and everybody will be waiting for them, and they will do an angiogram and try to salvage the heart muscle from dying. So that, by saving good 20, 25 minutes, have been saving lots of lives. So now they go straight to the cath lab. Any questions so far? Good. Yes.
I just wanted to ask, the symptoms you mentioned for the heart attacks, how long should they start before the heart attack may occur?
Usually, as I said, because the heart attack happens suddenly. So when that blockage, the clots form suddenly, that's when people have symptoms.
So most of the time,
You straight away, especially when it's a big heart attack. Now, you see people having like angina or the blockage, but not bad enough. So when at rest, they have no symptoms. But when they start to walk, go uphill stairs, do some activities, they need to put more strain on the heart, and that need more oxygen. And because of blockage is like 80%, for example, they develop symptoms. The rest, symptoms get better. So these people have angina, but the heart attack acute like this, as soon as it happens, people will develop symptoms straight away. And I said, could be short of breath, could be sweaty, dizzy. Doesn't have to be chest pain in particular, but that's one of the main symptoms. Okay, all right. Okay. Now, while waiting for the ambulance, because it might take 5-10 minutes for the ambulance to come, you could do a few things actually to save lives if you are the person or somebody actually that you know. The first thing is to chew aspirin, because aspirin is a blood thinner and can get a bit more blood flow through that. Because sometimes the blood clot causing the blockage, it's not 100%, could be 99, 95 or something like that. So by chewing aspirin, you make things a bit more, the blood more thinner, and hopefully a bit more blood flowing to that area of the heart that's affected, and that actually can save lives. But of course, if you're allergic to it, don't take it. Now, people who have angina or have issues in the past, like heart attack or heart problems, they have the nitroglycerin, like the tablet under the tongue, we call it in English, حبة تحت اللسان. So if you have that or the spray, you take it, because that actually allow more blood flow to the heart. So that all will buy time, will save heart cells from dying until the ambulance people arrive. Now, if somebody is unconscious, start CPR. You go on the chest, hopefully you guys know your first aid. If not, it will be worthwhile doing one course, because actually you can save lives. So you do CPR, go to the chest, and you compress. You compress as hard as you can. Doesn't matter if you break ribs. Breaking ribs is not going to cause a problem, but if patients not being CPR properly, actually they can die, because you need that pressure to push on the heart to get the blood flow to the brain, oxygen, and so on. So push as hard as you can. Doesn't matter if you hear crack, that's the ribs broken. Doesn't matter. Patient can survive that, not a problem. So go as hard as you can. And if there are places like shopping centers, gyms, whatever, you see those defibrillators. I don't know if you have one. Did we provide that? No. Actually, Alma provided defibrillators for most of the religions, to the Maronite, Catholic, Orthodox, everybody. We provided one for them to save lives. So if they're around, very easy. Just open it, put a pad here, pad at the back, turn it on, and usually it will work for you. It will see if there's rhythm like that soccer player or that rhythm I've shown you. It will give shock straight away and bring patients back to life. Okay, now how is it diagnosed? As I said, the ECG. I don't know if you remember the first one. Usually that line is meant to be straight with this line. You see how kind of big time. That is typical heart attack. And that's when the ambulance arrive and they do ECG on a patient or GP or whatever, and they see this line, that's acute heart attack. They start full treatment, aspirin loading, they call the cardiologist, the cath lab, and they take patients straight to the hospital. It can be diagnosed by a blood test, because sometimes it's not very typical of heart attack. It can be this or the other. We do a blood test called troponin, and it's a muscle, it's an enzyme released by the cardiac muscle. So if there's a heart attack, that muscle that's affected will release the enzyme. It will be quite high in the blood. Chest X-ray is another investigation. Usually people develop fluid in the lung, like back pressure. And the ideal test will be, as I said, the coronary catheterization or angiogram, people know, بالعربي التمييل. They'll go to the heart, they'll see where the blocked artery is. It's usually done, used to be from the groin, now they go from the wrist. It's not a surgery, I'll tell my patient, it's a procedure, because you'll be awake, they just numb the wrist with a local anesthetic, and then they put a small tube in your artery. And while you're watching, the bed and X-ray around you, basically. So once that's numb, tube goes to the heart, and they will give you contrast, like a dye or a brimlawane. They give you that, and they look at all those 3 arteries I showed you first, and they see which one is blocked. If any blockage above 70%, then they take the tube out, another special tube, they put a balloon, I think, here, the next one, please. So they put catheter through the blocked artery, they inflate like a balloon to crush that blockage open, and then they leave a stent and they pull back. That stent stays there, it gets covered by the blood the blood vessel lining down the track, so that will stay for long term, forever basically. And that's called like a chicken wire. It stays there to keep the vessel quite open. And those people need to be on special medications, like 2 blood thinnings for a year, and then we cut back to 1. But that's, by doing that, blood flow back to normal. And if it's treated sooner than later, blood will go, oxygen will go back to that dead or dying muscle that actually might survive again. Now, as I said, one of the tests available to find the risk factors, sorry, back, one more. Okay. Now, what tests are available at the moment to detect heart disease? There are lots of tests, but these are the most common kind of day-to-day we use. ECG, as I mentioned earlier, it will tell us if patient having heart attack or even angina, because that line going high, and angina, it will be actually going below. Also, it will tell us if there's a funny rhythm for the patient, the soccer player, or it can be different type of palpitations. I've seen lots of patients coming to my room with palpitations, and that can be another big topic, actually. I'll talk briefly about that because it's quite important. Now, palpitations basically means heart is going very fast, not strong, because lots of people confuse between strong and fast. That's strong, that's fast, and that makes big difference because that is palpitations going fast. And the reason for that can be many different reasons, but the first thing usually I tell patients, cut back on your caffeine. Coffee, black tea, green tea, cola, Pepsi, chocolate, and energy drinks. So if you do get palpitations, first thing we do, cut back on your caffeine and take magnesium supplement. Magnesium is a vitamin. It's harmless, not done in prescription, and it's quite useful for cramps and for the palpitations. But if the palpitation become more often and can cause you symptoms, then we need to see what kind of palpitation is it, because it can be treated. There are different types of palpitations. Some can be benign, very common in young people, and some can be dangerous because it can lead to clot forming in the heart, going to the brain, causing stroke. And those people need to be on very strong blood thinning medication, warfarin or those new oral tablets these days. So palpitation is quite important to find out what kind of palpitation is it and how to treat it. We have exercise stress tests. I'm sure some of you have been to my office, and we put them on stress test. So basically, we try to put the heart under stress, and then we combine it with the ultrasound. We'll see how the heart pumping at rest and pumping very fast. And we try to compare if when pumping at fast, all the walls are moving in symmetrically or one moving more than the other. These are signs that something is going on, and those people need to be referred to have an angiogram. The echocardiogram, it's the next one. It's like, that's a stress test. The next one. At the echo, basically it's just an ultrasound for the heart. That will tell us lots of information. If the patient have heart failure, look at the valve, if there's a leakage valve, calcified valves, fluid around the heart. We've seen lots of patients after the COVID vaccine and the COVID infection coming to my rooms with the chest pain. And then what they could have called pericarditis, which is inflammation of the sac of the heart, and then sometimes can be due because of fluids around the heart. So that can be picked up on the ultrasound. Now the CT coronary, just go back again, sorry. This test is very popular. Lots of people have heard about it. Back one more. Sorry. One more. No, back. Sorry, okay. There's a CT coronary angiogram. I'm sure lots of you have heard of that test. And we do it actually on lots of occasions. That comes of between stress test and the coronary angiogram. So what that test is a CT scan, and they'll give you the dye, the contrast. And then what they'll do, they'll look at all the arteries of the heart, and that give us an idea if there's a blocked artery. Now, lots of people coming to me say, I can have that test. Usually we don't do it because it has its limitations as well. It's not the best test. If you're under 40 years of age, it's not really accurate. If lots of calcification becomes over representing blockage, so it could say you have significant blockage while you don't, but sometimes could be quite useful. So we do send people for that. But also some people who have allergy contrast, like the iodine contrast, it's not good for them. And the MRI to look more for structural thing. Okay, next one. Okay, listen. Now, still go back. Sorry. Okay, probably you've seen it. Go one more. Okay. Now, we talked about heart attack, what heart attack is, what to do when you have it, what the symptoms that to alert you to that could be a heart attack, and what we do about it. Now, what are the risk factors of leading to a heart attack? Probably you've seen some of them already. Anybody?
Smoking? Drinking?
Smoking. Let's start with smoking. It's my favorite subject. When a patient comes to me, I ask them, do you smoke? And they say yes. I say, well done. Because if I tell them to stop, they won't stop. Then well done, and they start laughing. They get the message. Now, I'm sure lots of you have heard about the narghile. Does anybody know the narghile, how many cigarettes is?
60?
Up 200. You learned very well. Each narghile is equivalent to 200 cigarettes. So I tell people actually smokes, don't argue. Yeah, that's right. That's right. So because the problem you have the narghile and it's not enough to stay for fun. Actually, it's quite damaging. So if one thing you learn today when you go home, stop the narghile, I've done my job. Look, you don't have to stop straight away, but if you actually cut back, rather having narghile every day or rasen, whatever they call it, have it like maybe once every week, only few measure whatever, and then try to stop it. Vaping. What is better, vaping or smoking?
Smoking.
Vaping, that's right. People who are vaping, I tell them smokes, don't vape. Exactly, because it's much worse actually, and very addictive, and lots of young people actually now are addicted to vaping. I've seen so many young people actually in intensive care because of vaping, 17, 18, 19, because of vaping. Actually, it's quite bad because you don't know what's in it. Actually, the cigarettes, you know, it has tobacco, it's deadly, we know it. But it's not that deadly, not quickly as vape, because you don't know what's in the vaping, because all the flavors now, they hook all the young people. And if you look into the companies who actually owns the big vaping companies, are Philip Morris, the smoking people. So they know that vaping is the next trend now because people cutting back on cigarettes are vaping, and they're targeting the young people. You can see now 15, 16, 17 vaping. School now, they try to detect people, students who are vaping, try to stop them because it's very addictive and can be quite deadly. Vaping started to encourage people to quit smoking, but the problem is that people quit smoking and they become addicted to vape. So I tell them, stop the vaping. It's quite bad. Well, ideally don't go at all, but if you have to, I prefer go smoking and cut smoking. But I also tell my patient who smokes, basically, you will not stop smoking unless you want to stop smoking. I can speak to you for hours and days to stop smoking, you won't stop smoking. And I know it's not easy. I tell them it's not easy because they think, okay, the doctor let me stop smoking, I'm going to stop. It's not easy, I know it. But at least the first step is for you to start thinking that you want to stop smoking. That's the big step. And then from there, you can either see the GP to give you like treatment to help you quitting, or go cold turkey, or just cut back slowly and stop. Any way you do it, or acupuncture, or yoga, any way you do it, as long as you stop smoking, you're doing yourself a big favor. And later on, I will show you the risk factors if somebody who smokes compared to somebody who doesn't smoke. How you'll be amazed. Now, smoking, somebody mentioned blood pressure. Okay, blood pressure. We'll get to that. Blood pressure is another, actually, let's go to cholesterol because that's one on my list. Okay. Good luck with you. Okay. High cholesterol. Now, unfortunately, with our diet, lots of people have high cholesterol. Some people, even without having bad diet, they do have it, and that's called familial hypercholesterolemia. It means they have high cholesterol regardless because they run in a family. And those people usually will get, their cholesterol will be like 8, 9, or 10. Now, normal people don't have familial hypercholesterolemia. It's all mostly because of diet, lack of exercise, and our bad lifestyle. In the old days, when you used to turn on TV, you have to get up, press on the button of TV. If you have changed channel, you have to get up. Now you sit down, on your phone, you check your mail, you do business, you remote control your TV, everything. Basically, you have to even move the couch. And lots of people actually doing that. Plus our diet, everyone's working long hours now working from home. All they do, open the fridge, eat, come back, eating all day. And they don't eat the right food because one patient asked me, what is the good food for me? How can I know which food is good or bad? And I said to them, if it tastes good, it's bad for you. That's the bottom line, because it has sugar, salt, fat. Okay, so, but anything in moderation actually is useful. So if you eat fat, as long as you don't have lots of it, it's good. But you have also combined it with exercise. So with the cholesterol, try to avoid too much like dairy products, jibne, lebne, all this stuff. Have the low fat if you can. Eggs are good for you if you don't have cholesterol. It's good for the heart. But if you have cholesterol, the yellow part of the eggs are actually the cholesterol part. So have 2 or 3 a week. Cut back on the sweet, on the fried stuff. Try to like a grill most of the food. And exercise. And try to avoid eating out because any food takeaway is actually bad food. That's what tastes good. Because, for example, McDonald's, Big Mac, the bun has fat in it. We're overseas recently, everything has sugar. Even the bread has sugar and everything has sugar. So anything you eat from home, you take to work from home, is better than eating out. And now with these days, with the cholesterol, there are lots of treatment. We start with medications. And people who have heart attack, usually we have to go very aggressive with their cholesterol control. Their bad cholesterol, we call it, has to be less than 1.6. And there are limits to how much we go high on the medications, or some people have side effects of the medications, like muscle pain. For the last couple of years or so now, we have injection. Actually, taken twice a week. Sorry, 1 injection every 2 weeks. And then they can take it that, or they can take it 2 injections every month. And there's new injections in the market. You take it day 1, after 3 months, and every 6 months. And that have dropped significantly the bad cholesterol, and actually have been saving life, because lots of patients who have heart attack or angina or block the arteries, they on maximum therapy, the diet, they cannot do much better than that, and the bad cholesterol is still very high. Since that came in the market, actually, the bad cholesterol has dropped quite significantly. Next one. Okay, somebody mentioned blood pressure. Blood pressure is another risk factor for heart disease. Now, if you have no diabetes and no heart issues or stroke, the cutoff mark is about 140 or 90. Ideally, just below that, like 135/85. Or in Arabic, 14/9. The way you convert it, just divide it by 10 or take a 0 off. So 150, 15, 140, 14. So the maximum should not be more than 140 or 90. If you have diabetes, that drops to 130/80. And that can be, lots of people can walk around without knowing that they have high blood pressure. So it's good every now and then, if you don't have blood pressure machine and you don't want to go to your GP, just go to a local chemist. Get them, sit down for 10 minutes first, get them to check the blood pressure. Also, what I noticed lately, some people they have stress in their life, they go to the GP, they check their blood pressure, it's high. They start on a treatment. I do not agree with that. I'm not type of doctor that I like to give medications to my patients unless they really have to. So usually when you do have blood pressure now first time, try with the lifestyle first. Salt is your number 1 enemy, okay? So a bit of salt in the cooking, that's fine. Don't put table salt, bzurat, get the unsalted raw stuff, halloumi, it's pure salt, processed meat, salami, pastrami, pizza, everything have high salt in them. So if you do have blood pressure, watch your salt intake. It's very important. The less salt, the better. Also, lots of people have what's called the white coat syndrome, white coat for the doctor. So they do not have blood pressure, but once they're at the doctor practice, blood pressure is very high. Outside is normal. Those people do not have high blood pressure. So usually what we do, we put blood pressure machine on them for 24 hours. It's checked every 20 minutes, and then we'll see what's going on. I had the patients coming, it's only 22, came to me, blood pressure 190 when I checked it. Well, it doesn't sound right. So I put the blood pressure machine. Actually, it's 110 most of the time. So this patient, for example, if went to the GP, check the blood pressure, they put him on medication, put him on medications, and would have made it worse because his blood pressure is low. And if you put him on medication, it even lower, cause more problem. And plus, saving him being on medications and side effects. So it's good to always type of lifestyle, unless being high on multiple occasions, then it's definitely high. Next one. And so with the blood pressure, that's okay. With the blood pressure, also overweight can lead to blood pressure. Rule of thumb, basically, if you lose 10% of your weight, so let's say you're 100 kilograms, you go down to 90 kilograms, blood pressure will drop by about 8 points. So sometimes if you borderline high, like 145, you lose some weight, actually that can go back to normal. So by losing a bit of weight, you can save yourself from being on medications. So weight can lead to blood pressure, plus alcohol can lead to blood pressure. Too much coffee can lead to blood pressure. And also sleep apnea. I'm not sure how many people know of sleep apnea. I diagnose lots of patients with sleep apnea, which is not my specialty, but it can lead to blood pressure, palpitations, and can lead to heart issues. Sleep apnea is basically people when they're sleeping, they are snoring, but not all snorers have sleep apnea. So you snore, and then you stop breathing. So usually I will ask the partner, I don't ask the patient, and then usually always arguing, because I ask her, does he snore? She says yes, heavily. No, I don't snore. No, yes, you snore, you don't snore. So they're usually arguing. So that's why I don't ask the patient, because they never know. Ask the partner, does he or she snore? And they say, yes, they snore a lot. It's like relief to them telling somebody, yes, they snore a lot. And then he looks, okay. But as I said, they have to snore and stop breathing, like, and they're dead for like 30 seconds or a minute. And that's a sign that patient have sleep apnea. What it is, you lie down, you snore, and actually you block your airways. So actually no oxygen going to your lungs at all. Oxygen saturation drops. 95% is being normal. It goes down to 70. If you don't breathe, you will die. So basically, the brain wakes up and then and start breathe again. Some people can have that 20, 30 times an hour. So basically, it's like every 2 minutes you are waking up. Your eyes are closed, but your brain is waking up and sleeping, waking up, sleeping. And that's why those people actually, they feel sleepy the next day because they haven't slept that night. Although they say, yeah, but I sleep 5-6 hours. You are sleeping and your eyes are closed, but your brain is waking up 600 times. And those people need to see the GP to be referred to a sleep study, where they go somewhere, they put some dots on their brain and all that, and they check the oxygen. And then the treatment of that, either losing loss of weight or having the mask at night. And also, if you have sleep apnea and is not treated, you have about 25% more chance than somebody else to have car accidents, because you can have quick naps whilst driving. So it's quite serious, and that can lead to blood pressure as well. That's why I mentioned that. Now, diabetes. Diabetes is another major issue, basically, and killer in lots of patients. Can lead to stroke, kidney damage, eye blindness, leg supply, like artery supply to the blood supply to the legs. People can get their legs cut, and increase the risk of heart attacks. Again, lifestyle is very important. Carbs is number one enemy for diabetes. Bread, rice, pizza, pasta, potatoes, maize, lamb, ajin. Sure, is not good for the cholesterol, but it's good for
Bread or what you eat?
the bread, the carbs. Bread itself, yes.
Because usually we eat the bread with something else.
But something aside can be healthy. But the bread itself, the carbs, like rice, كل شيء معجنات, نشويات. Look, the less the better. Okay? You cannot, our diet unfortunately has lots of carbs in it. خبز منقيش. Rather than having manoushtain every day, have manoush every week, for example. Okay? Rather than having غفان على الوقعة, rather than having hummus بخبز, have a bit of salata. Okay? I know it doesn't taste as good, but if you want to prevent diabetes, prevent cholesterol, prevent from dying from heart attack, you have to sacrifice. Nothing comes easy, unfortunately. Look, you tackle everything as long as in moderation and less of it. Salad, I tell my patient, lots of salad, vegetables, grilled chicken, grilled fish, grilled meat, and you can have other stuff as well. So there are lots of actually varieties if you want, especially these days. Go to the supermarket, there are rows of healthy stuff you can eat. But look, it's a bit better, but it's still not it's still better than probably normal bread. But it's not. But look, as I said, our diet we have to have bread and most of this stuff. But rather, for example, have mjadra bkhibz, have it with salata, for example. You know, that's one way around it. Okay. Sash is a bit better. Sash and wholemeal, but still, Okay? 10. Look, as I said, everything in moderation. If you eat a lot of it, cut back, it will get better. And also, by cutting back on the carbs, you lose lots of weight. So if you eat lots of carbs and you stop it or reduce it significantly, you could lose 5-6 kilos within a couple of months. So it's very easy things to do. And as I said, nothing comes easy. You want good lifestyle, good health, you have to sacrifice a bit. And we talked about smoking. Next one. And lack of physical activity. As I said, we sit down on a couch, mobile phone, remote control, and we do everything without even moving. And lots of jobs are basically on the desk. So any activities is better than nothing. 30 minutes every day is pretty good. Even 20 minutes is better than nothing. And try to have a bit of power walk. You need to get that heart pumping bit fast. You know, if you walk, Gandhar, stop on doing it. Or like, you go for a walk, بتعبي جبتك بزورات or something, بتلاقي مش انتوا عايز. Like what's the point? So try to keep this. Don't do good thing in one hand and then take it from the other hand. So try to walk a bit fast, get the heart pumping. And I said 30 minutes you can take the dog, you go with your partner, quick power walk, 20 minutes, 25 minutes. If you could do it every week, every day, 5 times a week is better than nothing. And if you're gonna go to buy something from the shop, it's like 5-10 minutes walk, don't get the car, just go for a walk. Sorry? Uber, that's right. But make sure you stop the Uber like a few steps, like a few streets down, and then try to walk to Uber. Next one. Okay, now family history of ischemic heart disease. That's actually is a risk factor for developing heart diseases like heart attacks and so on. Unfortunately, nothing much you could do about that. You cannot change your family. You're too late. You're stuck with them. But it tells you something. Like I had a patient today, actually, he's 42. He had a heart attack 2 years ago. His father had heart attack and died age 50. His 2 uncles died of heart attacks age 50 and 145. His sister had stent already put in his 50s, and he still smokes. So my name is Dr. Charbel. I'm not Mar Charbel. I can't do miracles. I can help you. I can help. I can help you with the medications. We can help to control the cholesterol. We can help you control the cholesterol, get the blood pressure down, look after things. Family can change. It's too late, but you have to stop smoking. Otherwise, you're going to have heart attack. I know this guy's not going to live for too long because he's going to have another heart attack. No matter what I do, he's going to have another one. And sorry? So look, some people actually do listen to me and they stop smoking, believe it or not. But some people say, look, I don't want to stop, but the mood, but I tell him when your grandfather lived to the 90, he was living probably on the farm, working 24 hours a day, and then eating healthier, not like you're sitting behind the desk like all day, eating Big Mac, chips, and all this stuff. So it's different lifestyle as well. And as I mentioned, like put that high in fat, high in salt. So try to keep, in general, your diet low in sugar, low salt, and try to get used to the unsalted food, just a habit. Even though I like my salt, but actually if you cut down slowly, it becomes like a habit and won't affect you. And of course, high in fat and old age. Now, actually, next one, please. And as you grow older, of course, the risk factor goes higher. Okay, so that's actually a very interesting chart, and I think that's
You missed very important one.
old age.
Now,
Which one?
stress.
Look, stress will not cause a heart attack, but it can cause the other one I mentioned, that the broken heart, but that's not long term. If you have established problem in your heart, stress can make it worse. Okay, stress by itself is not gonna block your artery, but stress can lead to high blood pressure probably, and then stress maybe indirectly can lead to bad eating habit, etc. Eat junk food, don't exercise. So indirectly it can lead to it, but not directly. Now that chart should convince people who have smokes to stop smoking. If it doesn't, I don't know where else to go. Now let's just take an example, kind of standard case. Somebody in their 50 and 64, let's take men just to simplify things. I'll show you people without diabetes who smokes and people with diabetes who smoke and don't smoke, and you can see the difference. Now that chart, actually, you can check it yourself. You can go to the, I think, Heart Foundation website, look at your cardiovascular chart, and you can see where you fit in that chart. Are you at low risk, moderate risk, or high risk? What does that usually is? It's 2% per year. So if your risk is in 5 years 10% and above, you're at high risk. If you're up below 10% in 5 years, you're at low risk. So between less than 5, very, very low, 5 to 9, still in low risk, 10 to 15, moderate, and then comes very high after that. And that's usually percent of risk of developing cardiovascular disease within 5 years. Let's give you an example, then you know what I'm talking about. Let's say somebody in their 50s and 60s who have cholesterol of 6, high cholesterol, okay? And then blood pressure is 120, good blood pressure. They're not diabetic, they're non-smoker, just middle-aged man in a way, and cholesterol high. So that's non-smoker, that age, and 120. It's great. That's 5 to 9, that's low risk. Being a smoker, cholesterol 6, blood pressure 120, same age, 16 to 19. From being low risk to being high risk, we haven't changed anything. Same blood pressure, same cholesterol, same age, same family history, same everything. By being a smoker, you're going from low risk to very high risk automatically. So that's why smoking is very important. And usually I tell my patients, smoking and diabetes, it's a time bomb. You don't know when it's going to explode. It's a very bad combination, both of them.
Doctor, if you are diabetic and high blood pressure is controlled by tablets, and it's controlled perfectly, are you still at high risk or?
Won't be as high, no. If you have risk of history of hypertension, high blood pressure, on medication well treated, your diabetes is well treated, of course you're going to be at risk somehow, but it won't be as uncontrolled. That's right. That's right. That's right.
Thank you.
No worries. If you look at the second slide, we look at the same patient who's 55 to 64, non-smoker, cholesterol of 6, good blood pressure. Being a diabetic, it's already put you at moderate risk. Before, so he wasn't diabetic, wasn't smoking, he was in low risk. Smoking was straight to high risk. Just being diabetic, not even smoking, it goes to moderate risk. That's why I said diabetes is quite important. And it's very modifiable disease. As I said, by good diet, exercise, you can control it very well, unless it's type 1 diabetes where you actually born with it or your pancreas is completely gone and then you have no choice with that. Now, if you are diabetic, cholesterol of 6, in your 50s, good blood pressure, but you smoke, goes to 25%. So it's very, very high risk. Smoking with diabetes, it's very, very bad combination. As I said, it's time bomb. You don't know what's going to explode. You don't know when it's going to explode. I hope that chart will have convinced you to think again if you do smoke. As I said, it's not easy to quit smoking, but at least start thinking about it and try to watch your lifestyle, exercise, improve your diet.
You should have a shot to show the algae as well.
Sorry?
You should have a shot to do the
I know, but that's probably smoking very high, that they go high. Absolutely. Look, it is, but it is not as bad as smoking. Like probably you have to smoke, probably every packet of smoking, equivalent maybe to 2 or 3 cigarettes passive smoking. Yeah, but if one, depends how often that happens. Sorry, 1 second. See, that doesn't happen every day, but if every day you are living with people, well, tell them to smoke outside. Very simple. Tell them you don't want to die like them. It's like you are smoking, but not as much as them, and maybe 20%. Yeah, it's like, as like every cigarette that you inhale from people around you, maybe equivalent to maybe 3 or 4 cigarettes that you smoked. No, we do know passive smoking actually depending on the person actually with you, as I said. But if every day somebody smokes a packet next to you, after like a few years, you're gonna get something done to your lung, obviously. So simple steps to healthy diet. As I said, eat healthy, more vegetables, more salads, less fat, less sugar, less salt. Try to walk on a regular basis, exercise, try to come up with a hobby or something that keep you going rather than just sitting behind the couch watching all those Mexican and Spanish musalsalat, whatever. Avoid adding those sugary drinks. Try to get water. Nothing beats water. And choose healthier source of fat. Like nuts are pretty good, but of course, get the raw nut, not the salted and or the cooked nut. And the problem with us, I have Aussie patients that tell me, okay, I have every day 4 pieces of walnut. It's perfect. But the thing is with us Lebanese, we put like nus kilo and then we go for the whole bag. That's no good food. Actually, بحط كيس بنزل فيها تخلص. So basically, having a little bit of nuts, actually, they're pretty good for your heart, good for the good cholesterol as well, especially the walnuts and almond, but not too much of it. And the worst thing also to try not to gain weight is try not to eat after 6 o'clock. The worst thing is to eat and you go straight to bed, especially having a big meal. So try after 6 o'clock, have a light dinner and try to go to bed without food after that. And always, any concern, any worries, you always go to your family doctor. Try to do, once you become in your 40s or 50s, try to do blood tests routinely, like every year. Try to do blood tests. They can check your cholesterol, your thyroid, because that can lead to palpitations. They can check your prostate if you're male and then female and other tests. So always go to GP, do blood tests on a yearly basis. They can check lots of things. Lots of also people, besides this topic, have vitamin D deficient, and that can lead to lots of neurological problems. So get routine blood tests, and you can take supplements for that. Now, I have a couple of slides that which interest to you. I thought stop from talking and just bombard you with.
Just one question, Doctor. Indigestion, should that mimic a heart attack?
Indigestion, if it is indigestion, it's not to do with the heart. But sometimes indigestion, if you have lots of acid, can cause a bit of reflux, and it feels like heart attack. I have lots of patients have symptoms typical of indigestion, of heart attack, and it's pure indigestion. So it can go up and can feel like heavy on your chest. And usually they're treated by antacid and so on.
Sorry, doctor, we have time for question and answers.
Yeah, definitely.
There's a small presentation.
But I have actually one patient who came to hospital with indigestion. It was a heart attack.
Can it cause a heart attack?
Indigestion itself, no. Indigestion just extra acid in the stomach. It doesn't cause, but can cause a bit of palpitations if it's bad enough, and can cause feeling that it's actually coming from the heart. Now, this video, I just have a couple of videos I want to show you, just interesting, just to show you what we have come to now in the world of cardiology. You've heard of valves being replaced from the groin, because lots of people are quite old these days, because the people are living longer and they're developing lots of diseases. One of the valves, the one I mentioned, the one, the 3 and 2, that aortic valve, aortic gets quite calcified and becomes quite severe. But some people, like in the 80s, they have kidney problems. They cannot tolerate open heart surgery for the valves. These people actually have very short prognosis. Within a couple of years, they will die if nothing can be done about it. But these days, thanks to the new advanced technology, it's a very small procedure. They go home the next day, and that valve usually is pretty fixed, and they live 5-7 years without any symptoms. Because people with severe aortic valve calcifications, they have lots of short of breath, lots of chest pain, and they can walk from here to the door. But once we put that valve in, they can walk much longer distances. So just to show you how it's done, it's quite interesting.
The transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's
not open like this. It's only open a little
the
bit.
motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted.
They go from the groin,
and they go threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve and placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve. The balloon catheter is then inflated, opening up the stenotic valve, cracking the plaque, and freeing up the leaflets. And that's in preparation for the stent valve, or the transcatheter valve, to be inserted. And the first condition that you see is the first stage of the catheter going in, and then the second stage of the catheter coming through around the aortic arch, over the wire, and it's going to insert into the stenotic valve. Once the catheter is placed in the valve, the stented valve is ballooned open,
The pressure to crash open that
pushing the
calcification.
diseased leaflets out of the way and leaving a functioning aortic valve in place. And then the wire is removed, and you can see the leaflets of the aortic valve opening and closing, providing normal flow through the valve.
And that stays in the heart, and that's normal. So those people without that procedure,
Transcatheter aortic valve replacement is revolutionary in the fact that for the very first time,
so that valve condition without that procedure, those people actually will die within 6 to 12 months because they're not surgical, not candidate for intervention surgery. Because surgery, like open heart surgery, they have to be on a machine that replaces the heart and so on. So those people, they will be dead. Now actually they're living 5 years, 7 years with no symptoms, and we're improving also quality of life. The next one, another video, but different type of valve. It's actually a leakage valve. So the valve is rather than closing properly, kind of flail open, and loss of regurgitation, leakage valve. And again, those people without intervention that cannot tolerate surgery, they will actually die with symptoms, short of breath, heart attack, and so on. Now they do what's called mitral clip, as in stapler, basically, and then actually they'll again go from the groin. It's an interesting one to watch. But not all patients are suitable for the procedure, certain types, especially with this one.
the heart is one of the most important organs in the body,
See?
working
Yeah, agrees with
relentlessly
me.
to enable the human cardiovascular system to function. The heart has 4 chambers, the upper right and left atria, and the lower left and right ventricles. In a healthy heart, blood flows in one direction through the heart's chambers. Delicate tissue-like structures called valves function to ensure unidirectional blood flow within. The heart has 4 such valves, which regulate direction of the blood flow. The mitral valve separates the left atrium from the left ventricle and is made up of 2 thin flexible flaps called leaflets. When freshly oxygenated blood from the lungs returns to the heart, it enters the heart through the left atrium. Left atrium relaxation causes the mitral valve to open, enabling blood to travel into the left ventricle. When the left ventricle contracts, the mitral valve closes to prevent backflow. In some people, the mitral valve doesn't close tightly, causing mitral valve regurgitation. When the heart beats during contraction, the blood from the left ventricle can flow back up to the left atrium. Mitral regurgitation, MR, can be subdivided into functional and degenerative subtypes. Degenerative MR, or primary, results from anatomical abnormalities of the valve itself. In most cases, the chordae connecting the mitral valve to the papillary muscle rupture or elongate, causing leaflet prolapse. MR is a progressive disease which, if left untreated, can initiate a series of events culminating in heart failure and death. Current guidelines recommend surgical mitral valve repair or replacement in severe MR patients. For MR patients for whom surgery is not an option, minimally invasive procedures are available. MitraClip is a unique, highly maneuverable transcatheter system for mitral valve repair. This procedure avoids cardiopulmonary bypass using minimally invasive venous approach.
They have to go from the right to the left, have to go through the
And
top chamber.
transeptal puncture to gain access to the left atrium. MitraClip's steerable guide catheter is introduced over a previously placed guide wire. The dilator is used to gradually advance the guide into the left atrium, and the guide wire and dilator removed. The clip delivery system is advanced into the left atrium, positioning the clip above the regurgitant jet and perpendicular to the mitral valve plane. Inside the left atrium, the clip arms are open to 180 degrees and positioned perpendicular to the line of coarctation before crossing into the left ventricle. The clip is advanced into the left ventricle below the valve leaflets and retracted to grasp the leaflets. MitraClip grippers are designed to drop firmly into the clip arms, securely capturing both leaflets. Once the arms are closed, they create a double orifice within the mitral valve. Prior to clip deployment, echocardiographic imaging is used to assess procedural efficiency and leaflet capture. Prior to deployment, the mitral clip can be released and repositioned for optimal MR reduction.
Keep trying till they see there's no more leakage.
Once achieved, the clip is released and the full system retracted. In most cases, the transseptal puncture
All right, any questions?
ترتاح شوي تعبناك كثير الليله.
يعطيك العافيه.
الله يعافيك. Thank you.
تعبناك الليله كثير وشرح كثير مفيد ومعلومات قيمه. هلا سننتقل الان من قلب الانسان الى قلب الوطن. ما فينا ما نحكي عن لبنان. الى خير رسول للبنان يفاخر بانتمائه لوطن الارز. مناضل حقيقي انتماءه وطني ولاءه لبناني شعاره الأمانة والتفاني. حمل الأرزة في قلبه ووجدانه صاحب مسيرة مشرفة وطويلة طوتها صفحات مليئة بالوطنية الصادقة والإخلاص لوطنه والشجاعة والإصامية. وقد عمل جاهدا في عدة جمعيات ومؤسسات ومنها الجامعة اللبنانية الثقافية في العالم التي شغل فيها منصب نائب الرئيس العالمي ورئيس المجلس القاري للجامعة اللبنانية الثقافية مرتين. تأثر بابن بلدته الفيلسوف العظيم جبران خليل جبران، ومن أجمل مقال: حب الوطن لا يكمن في الهتاف له وإنما في خدمته والمساهمة في بنائه. المنبر لك الشيخ الشعريدة الرئيس القاري للجامعة اللبنانية الثقافية في العالم وأستراليا ونيوزيلندا.
مساء الخير واهلا وسهلا بالجميع. Doctor, straight away, I'm so glad that you do have a new medicine for broken hearts. So I thank you for that. Ladies and gentlemen, I'm going to be very brief and I will speak a bit in English and of course a bit in our Lebanese language. First and foremost, on my personal behalf and on behalf of the World Lebanese Cultural Union Geographic Regional Council for Australia and New Zealand, may I welcome each and every one of you here tonight and thank you, ladies and gentlemen, from the bottom of my heart. You are all most welcome. No words of gratitude can be found to thank someone who has devoted his entire life to help his brother human being. You saw what the technology do and has done and is doing. But with the technology, it takes a special human being with a heart to do and implement these things. Dr. Charbel, no matter what I say to you tonight, no matter what words I try to find, I am humbled in front of your majestic knowledge. And I thank you on behalf of all of us for everything that you are doing to your human being, brother and sisters. I also do know that some of you here tonight would not be here tonight if it wasn't for Dr. Ghassan Charbel. Your sign of gratitude, your sign of goodwill, your thank you is all what this gentleman requires. And to know that you are so grateful, it is the best thank you that you can render to someone like him. So on behalf of all of you, thank you, Doctor. Also, through you, Doctor, I would like to acknowledge two very special people here tonight, as I do acknowledge all of you, without exception. And I will not repeat the names because each and every one of you so special and so dear to us. But two very special people. One that came from a long distance from Melbourne and represent our chapter in Melbourne, Mr. Ghassan Charbel. Thank you for coming all the way from Melbourne to be here with us tonight. And I thank you on behalf of all of us. Also tonight, there is a special dear family. Not long ago, they have lost their father. Their father, their mother, the whole family are all. You have looked after all of them. And to know that today they commemorate the passing away of their father, and it's a very, very special day for them where, you know, the tradition, they sit, they pray, they do all that sort of thing. Once they knew that you are here tonight, they put the tradition aside and they said, no, we will leave the tradition and we will come to say thank you to Dr. Ghassan Charbel for everything he has done. To you, Susie Fakhri, to Carlos Fakhri, I welcome you and I thank you very much for being with us tonight. I will stop here and I will say a few things in Lebanon. تسمحوا لي اقول لبناني لاني لبناني وبفتخر بلبنانيتنا. على كل حال بهالحياة حلو الانسان يكون وفي. في جملتين ورح بلش فيها. الوفاء والاخلاص. هاو كلمتين يمكن صغار بس كل واحد منكم غمض عيونه لدقيقة ويعرف شو معنى كلمة الوفاء والإخلاص. ومن هون بدي أحكي اللي بدي أحكيه بلغتنا وتسمحوا لي الليلة بما إنه حديثنا الليلة من القلب للقلب رح أحكيكم من القلب للقلب ورح أترك كل البروتوكولات على جنب. لا ما في خطابات، لا ما في شعارات، لا ما في ترحيبات، لا كله هيدا ببروتوكول الليلة بنتركه شوي على جنب ورح نحكي من القلب للقلب لنريحوا شوي للحكيم. معلش رح تسمعوا على صوتي كم دقيقة تكون مرتاح وبنرجع بنطلع على المنبر وبناخذ كل أسئلتكم أي سؤال اللي بتحبوا تسألوه. طيب دكتور معلش قبل ما بلش بدكم تسمحوا لي أحكي راسي وأتشكر من كل قلبي باسم الجامعة اللبنانية السقفية في العالم الاستشاري أستراليا وموزيلتا. اتشكر سيادة المطران باسيليوس يلي سمح لنا نكون موجودين عنده الليلة. وأكيد ممثلين هون الليلة بنحب إنه توصلوا له معروف كل شكر تقدير واحترام ومحبة إنه سمح لنا نكون عنده بهاللقاء الليلة. طيب هلا رح نفوت دغري بالموضوع. بما إنه الليلة حديثنا من القلب للقلب وبما إنه نحن من مدرسة واللي منكم بيعرفني بيعرف أي مدرسة علمتنا هي الوفاء والإخلاص فبقى تسمحوا لي أحكي هالكلمتين بوفاء وبإخلاص. كيفكم فيكم تقعدوا على جوجل وتشوفوا جوجل وتتعرفوا على الحكيم. بس الليلة عندي كلمة سبرايز بحب لكم مش رح تقدروا تلاقوها على جوجل. دكتور هذا الحديث لك من خيل لخيل. شو ما أقول الليلة بضل قليل وأي كلمة بدي لاقيها كان بالعربي بالفرنساوي بالإنجليزي باللبناني بأي لغة بالعالم بتحكيها ما رح تقدر تكافي أشغالك وخدماتك اللي عم تعملها لخيك الإنسان. فبقى من هون صحيح وأكيد إنه صغير بالعمر وشفته لا ما عمره 80 سنة ولا ما عمره 70 سنة شاب وحلو كمان شاب وحلو ومرته الشمالية كمان بقى كيف بتكلم مع حبوها ثاني على كل حال صغير بالعمر ولكن صدقوني كبير بالاخلاق كبير بالمحبه كبير بالإنسانية وكبير بالعاطفة. هودي ميزة ما بتنشرى وما بتنباع. ما فيني اشتري الأخلاق، أدب يا الإنسان عنده أخلاق يا ما عنده. سبحان الله كملها مع هالإنسان. ورح خبركم خبرية صغيرة عنه لأنه هلأ ارتاح وبدكم تسمعوا عليه أكثر مني أنا. كيف بلش مسيرته؟ طيب هذا أكيد مش أحكيه على جوجل. شاب ربي بالبيت، أهله ربوه، علموه، تعبوا عليه، وأهم من هيدا كله شرف علموه الإيمان بربه. والإنسان اللي عنده إيمان ما تخافوا منه. حطوا ايده بيده ما تخافوا منه. هلا شاب رح تسمح لي بس لدي يا دكتور سمين غسان هلا بس اوكي. الشاب راح على المدرسة بلبنان، شاب صغير غسان يركض على المدرسة ويرجع ويتعلم ويطلع وينزل وكذا. من مين كان متأثر؟ أكيد الطفل العقول بمين بيتأثر؟ بيتأثر بأهله، ببيته، ببيئته، بمجتمعه. بس أهم تأثير على الأولاد مثل حضراتكم كلكم بتعرفوا المتجوزين وعندكم أولاد، تأثير اللي تكون على أولادنا. هالشاب غسان وبتي غسان شو عمل؟ تأثر كثير. بمين كان متأثر؟ كان متأثر ببيه. بيه كان نون ليديال لغسان، كان هيز ايديال. وبيه كان اللي كنتوا يعني بتعرفون من هالشخصيات الواعية، هالشخصيات اللي واحد بس يقول رجال بكل معنى الكلمة. كان غسان كثير متأثر فيه. ولا للأسف على عمر 14 سنة بعز دين شبيبته طالع الشاب مثل ما بيقولوا حليب النار 14 سنة من ولاد الدنيا قدامه. وبيه توفى الله يرحمه. تصوروا ابن 14 سنة ومن ولاد الدنيا قدامه إلا بيه، وطموحه ببيه، وكل شيء ببيه، وبليلة ما فيها ضوء قمر راح البي. وأكيد الأم لعبت دورة وكملت المسيرة. ولكن بنتي غسان بهذيك الفترة تأثر كثير ببيه، وشاف بيه شو تعذب بالقلب، وشاف بيه بهذيك الفترة. بدنا نرجع أكيد سنين لورا، الطب ما كان متقدم مثل ما اليوم، وشفنا كلنا الطب شو صار متقدم. أخذ على عاتقته هالشاب وقال أنا إذا عم بدرس 5 ساعات بالجمعة بدي أدرس 10 ساعات بالجمعة. وإذا كان أنا بدي أعمل هيك أنا بدي فوت وصف الطبيب، وبدي أدرس القلب، وبدي أقدر أوصل يوما ما، وقال له يا بيي يلي عم بتشوفني فوق بهالسما، أنا ابنك غسان، ندرت نفسي، ندرت حياتي، ندرت مستقبلي، لأني أنا بدي خلص العالم. شفتك أنت شو كذبت، شفتك أنت شو صار، شفت الطب بلبنان، أنا رايح أتخرج، أنا رايح أدرس، أنا رايح ضحي، وإذا الله وفقني يوما ما وعدي لك يا بيي، وفائي لك يا بيي، إيماني فيك يا بيي، أنا رح أقدر أخدم خي الإنسان. وبلشت الحياة من 14 سنة لهالإنسان اللي شفتوه اليوم، لجران غسان، اللي صفى دكتور، اللي كلكم بتحبوه، اللي كلكم جايين لتقدروه، اللي منكم ما بيعرفوا سمعتوا عليه اليوم، واللي جايين من مسافات بعيدة ليتسمعوا عليه. دكتور صدقني باسم زملائي أعضاء الجامعة اللبنانية، باسم كل محبينك اللي موجودين هون، نحن بنشكرك انك وعدت وفيت لبيك، وبينك اليوم بالسماء عم بتطلع عليك وعم بيقول لك برافو يا ابني، انا فخور فيك يا ابني، انت مبيض لي وجهك يا ابني. ومش بس انت مبيض وجه عائلتك، نحن بنفتخر بمجتمعنا اللبناني باستراليا، كما بنفتخر بمجتمعنا اللبناني الكبير بلبنان يكون عندنا اطباء مثل امثالك مستعدين يضحوا ويعطوا لكل مواطن لبناني. نحن بنشكر كل خدماتك ونتمنى لك كل التوفيق، وربنا ومر شربل وجميع القديسين يكونوا معك. ميرسي واهلا وسهلا فيكم جميعا. ما اقدر اطول عليكم، في عندنا عربون تقدير ومحبه من الجامعه اللبنانيه للدكتور. بحب اقدم له اياه ابراهيم. وين جوسلين اذا فيك تجيبيه ابراهيم، ثانك يو. واكيد رح تتسمعوا بعد 10 دقائق مع الحكيم اذا عندكم اي اسئله.
تفضل دكتور. مين عم يصورنا؟ عملوا معروف دكتور. ثانك يو. تفضلوا. تفضل بس بتحط عويناتنا لانه ما بقى عم ننشا.
شو بدنا نحكي لها عيون مرة ثانية؟
ماشي بس ثانك يو. ثانك يو. مفقود. Thank you. Thank you. السلام عليكم. تفضل حبيبي.
Thank you, Saeed. Thank you. You want to speak? Okay, now time for the questions. Does anybody has any questions?
From Melbourne, did you
Hi.
هاي سماوي شرفت. كنت راح لك I had كنت راح لك I had all of the above. I'll tell you the story.
Thank you.
Thank you.
Thank you.
Thank you. It's a pleasure.
Thank you. Nice to meet you. Thanks for coming. All right. It's question time. Okay. Share sides first. Sorry, can just the questions, please? Can you please just tone it down, please? Thanks. Right? Sorry, one second.
Do you perform the catheterization or do you opt to do the electroshock? Just like
For the hospital.
yeah. For if would you get it with hand as well? You can get
Now, heart failure is a very broad disease. can be caused by multiple conditions. Heart attack is one of them. So basically, with the heart attack, when the muscle dies, the heart becomes weak. And heart failure is when the heart cannot pump very strong and the muscles are weak. So heart attack can lead to heart failure. However, not every heart attack can cause muscle damage. So if the patients arrive to the hospital at the right time, they can salvage the heart muscle and have completely normal pumping of the heart. Now, if it's bad enough or they are present to the hospital quite late, damage can be done and can lead to heart failure. Now, heart failure are so many causes for that. For example, that leakage valve, if it's bad enough, can lead to heart failure. So it's not dependent on what the cause. Now, if people have arrhythmias, like bad arrhythmias, especially loss of extra beat, quite bad one, can lead to heart failure. And those people, we can do like ablation. They go from the groin to the heart, they see where the extra electricity coming from, they burn it to stop that from coming. If you have, can lead. So this, because as I said, sometimes it's just the virus. Some people, 34 years of age, completely well, they have chest infection or something like urine infection, something really bad. That virus can attack the heart muscle. So that can lead to heart failure. But then hopefully put them on the medications. But everybody who comes with a heart failure as first presentation, we have to make sure there's no ischemia, they don't have any blocked arteries. So we have to do an angiogram or CT scan to make sure they don't have that. And then we can do blood tests as well, because sometimes special type of diseases can lead to that. So exclude the common one, and we can do that. And some people have like hypertrophic cardiomyopathy, it's called HACI, that's hereditary. So if that patient has that, we have to make sure that they bring all the kids and their brothers, sisters, and their kids to bring. Depending on what the cause of heart failure, with angiogram, blockage, there's a virus, and so on. And if they're very young, despite all medications, the heart's still pretty good. Some people are 20% are barely moving. Those people will be candidate for heart transplant. Send them to the heart transplant and get worked up for that.
Doctor, can you please explain the pulse rate and how low could it get in the range of the movement?
Okay. Now, there's a wide variety of normal pulse rates. Usually the standard at rest, between 60 and 80. Usually we don't like it to be higher than that because, look at it this way, if it goes too fast, it's like you're running. You can run for a day, but you get tired. The heart, same thing. If it's going too fast all the time, it will get tired and then lead to heart failure. So 60 to 80 is normal heartbeat. Some people had suddenly from 80 goes to 150, what's called like the short circuit SVT, happening in young people, and that need to be treated, but then it comes back to normal. Some people have low heart rate. Now that can be due to medications or can be just their own pacemaker. So when it comes very low, depending how low, usually up to 40, 50, we can accept that as long as you have no symptoms. If you start to get dizzy, like having blackout, you go to 5 pacemaker. Okay. And then some people actually, usually people have fit people like athletic people, like run marathon and triathlon like every day, they usually have very weak heart rate, very slow heart rate. And those people have to cut back on exercise. Otherwise, basically, that. Sorry.
That if someone having a heart attack, we advised how to do CPR and give them
CPR only if the patient is unconscious. Don't do CPR when somebody's awake because they don't need it. CPR is when patient is unconscious. The heart is not pumping because if they are conscious, it means there's still blood is going to the brain, oxygen, and so on. So when somebody's awake, do not do CPR. They have to be like unconscious. Pretty good, pretty fast, within a few minutes. Within a few minutes, pretty good. We can give 2 tablets. Usually the ambulance will give you 2 tablets if you come. We'll load up. And back to your question with the heart rate. People with heart failure, they have to have very slow heart rate. So someone who has a heart failure, heart rate of 70 is quite high. It has to be around 55. Blood pressure has to be around 105, the top one. It has to be very low because if you have heart failure, you want to relax the heart. It goes fast, get tight, so the slow, the more place of recovery. So we give them lots of to 50, 55 to help improve the heart failure.
So What is it?
It's when you have blood pressure, so hard. Sometimes they can be unrelated. So you have to treat the blood pressure with medications that should not affect the pulse. And then depends. Pulse, then it can. I have few patients in the mid-40s. I have no symptoms, but those patients will end up having pacemaker at some stage. But we don't put a pacemaker unless because it's a foreign body. You need to put it, check irregularly source of infection. So usually we put it until they become symptomatic, like dizzy, lightheaded, or they're black for no reason. Yes, they can have symptoms. They can have some symptoms. Yes.
What about angina? Can you explain a bit more?
Okay. I don't know what's angina, the actual word in Arabic. No, shaket is pain. Angina, it's waja, caused by the heart, it's not getting enough blood. So if you have blocked artery, no, this is not really a heart attack. It's ischemic disease. It's like they have blocked arteries, but not bad, and it's not bad enough to cause heart attack. For example, they have blocked artery up to 70-80%. Okay, they're still getting some blood flow through that artery. Okay, if you're doing nothing, the heart doesn't go very fast, doesn't lose oxygen, you're fine. If you do have significant blocked artery, 18, 17, 1 or 2 vessels, and then you exercise, that's become angina. Okay? No, DAPHA is heart attack. Sect LB is cardiac arrest when the patient's unconscious. That's angina. Angina, no, مش نوبة. It's وجع. Yeah, but if you have angina, basically you exercise and getting symptoms, something is wrong with your heart. So you need to see the cardiologist to do angiogram. That's right, because you lead to heart attack if you don't look after too quickly. So that's the angiogram. If they have blocked artery, they present. So relieve the symptoms. Angina is the symptoms.
I just want to ask one more.
Sure.
Sorry.
Medical Association, yeah. I'm the vice president. I was the president, yes.
You know how while you were explaining, educating your very simple part, your patient, they should do the 90%, which and the medicine should be the 10%. And you said, what about, for example, diabetes, you talk what about that? Do you target them? Do you speak with them? Because you don't have that combined effort of awareness and mindfulness.
But we don't target them. We're not going to target the poorest companies. Well beyond us. That's too political.
To prevent بدون ما يسأل الحكيم.
In the past, 5-10 years ago, everybody in their 50s, now sugar, بدخنوا automatically they go on aspirin. Actually, if they come to me, I tell them stop the aspirin. Okay, unless they have stroke or mini stroke, or they're known to have some blocked arteries, aspirin actually might harm them more than benefit. It does benefit a little bit from reducing risk of stroke, heart attack, but the side effect of it is higher than the benefit. So it comes ulcers in the stomach and bleeding and so on. So for the last 5 years, studies came out showing that unless you need it to have heart attack or angina or something like that, if just you're 56 years of age, with blood pressure, you have diabetes, I tell them stop this aspirin. You're stopping it now, not anymore. But cardiac is aspirin but coated. So if the people have any stomach ulcers or issues with the stomach, they have symptoms with aspirin. So cardiac is a bit more gentle on this. Cardiac is strictly aspirin. Exactly, like if you're 50s, 60s, diabetes, but nothing, stop stop Cartier's aspirin, have to stop. No, that's what I'm saying. If you don't have stroke or evidence of blocked arteries, it's not beneficial. So the risks outweigh any benefit. So ضرر أكثر من استفادة. Some valves are hereditary, like that valve I mentioned, a set of 3 has 2. That's usually hereditary. If there are few types of leaking valve or tight valve, it runs in the family. So these people will tell them to get the kids checked. But sometimes it just happens because of age or something happened. Something has gone on inside the heart. So depending on that's why the ultrasound, it will tell us if it is hereditary or just being old age or something like that. No.
Okay, just a question, please, doctor. What the symptoms of having high hypertension, especially around a very fast one, is that something that somebody should be concerned about?
Are they regular, palpitations? And usually we need to do an ECG. We can put a 24-hour machine on you to say when it happens, if you can pick it up. If that fails, with another device called PAP, we can keep it on you for 30 days. Because some people have bad palpitation but happen once every few months. So we try that. If that fails, there's another procedure now we do it. It's called loop recorder. It's like half size of the USB. You go to the hospital, you put it inside you. And that can stay for years. Because I had a patient, every 6 months she collapses. She walks, she falls. She's an old lady, she hits her head, bleeding, and so on. We cannot put a pacemaker unless we know what's going on. So I put a halt on her, picked up nothing. We put the 30 days, nothing happened. 3 months after, she had another fall. So we put that loop recorder. 9 months down the track, she had another blackout. We looked at it, heart stopped beating for 7 seconds. We put a pacemaker and she was fine.
Doctor, finally, regarding to that topic, a heart patient, how long is expectancy of a heart patient?
Pacemaker. Yeah. The pacemaker depends how often it's used. If it doesn't use very often by the heart, it can last 10, 12 years. People with a heart with a pacemaker, they get checked every 6 months or every 12 months. And when they check it, they will see if any rhythm happened. They will see if it's working properly, and they will tell you the life of the battery. It's 10 years. And when it comes close to 12 months, you'll be seeing more often change the generator, just battery without delays. They unscrew it, put in battery. It can be true because depending if it can because if for example you eat lots of salt, have bad diet, you're overweight and you don't exercise, and you have blood pressure, you need to go on treatment. But if you improve your lifestyle, lose weight, exercise, and blood pressure starts to drop, it can be reduced or probably stopped. But if you don't do anything, it will get worse because as you grow older, what's the blood pressure as the arteries become stiff. As you grow older, it becomes stiffer and stiffer. So blood pressure goes high. So once you start on medication, unless you take your life very seriously, lifestyle very seriously, and you improve your lifestyle, you can end up with time, end up eating one medication, 2, 3, 4, so on.
أنا ما عندي شغلة 12 سنة جيت زيارة على أستراليا كنت زي ما حكيت بدي بحس قلبي عم بخبط وصلت لعنده قلبي عم بخبط عمال يجي دواء
بايكور. البيبان بعتوا كلهم بايكور.
شكرا بعد شهر زرع استراليا خبر خيري مقصود في كذا شيء وعن خبره شيء طبيعة تصنع المخاطر القلب حتى لي ماشين القلب مش كله لا حتى لي ماشين ترى هذا مش كنت اسمع يقول دواء بتاعنا هذا كان 13 وقفت
كونكور
وقف لي اياها وانا بس بتوقف بالجيل شهر وقفتها من 13 سنه وانا كنت عم لحد دمه ولا
بس لازم على الكونكور كل واحد بيبان معه palpitations, blood pressure, headache, they give Concor. Concor whole one for people with heart failure. You don't give it to people with blood pressure. So they come here and I stop it. Concor. No, he was called Bicor. Okay, go for it.
The main question is when you born, shouldn't the hospital pick up the arrhythmia when the baby is born? Arrhythmia for AF?
AF is very uncommon. The different type of palpitations.
The reason I'm asking about my daughter was born with arrhythmia and lung affection.
Because the arrhythmia is the electricity of the heart and runs through the heart wall. So if any changes to the heart, if any problem to the heart wall, that can lead to arrhythmia. So if it does have arrhythmia, like the one I showed you over there, they should probably have either ablation, try to burn it. If that works, working. If it doesn't, we should defibrillator.
Well, my main question is, should they have him take that birth?
Sometimes they don't.
Cardiologist, they just shrug his shoulders.
Look, unless she has symptoms, they're very hard to know because we don't just go there, we call all babies. Unless they like short of breath or they're not growing or they're fainting for no reason, then something could be going on.
The catheter is that, does that cause kidney damage?
It's the dye that can cause kidney damage. If you have normal kidneys, no problem. If you have kidney impairment, it can, it's more risk of getting worse. I have lots of patients who have renal kidney impairment, and then they need to have an angiogram. We have to do it anyway. Okay, so we have to do it, but sometimes when we do, we put them in the hospital, they give them fluids, well hydrated, and then it's not the angiogram that causes the damage, it's the contrast that we give. The contrast that we give is quite gentle on the kidneys. And then once we know that the patient has kidney problem, usually we don't give too much contrast in the procedures, we go gentle. And so give them good hydration before and after to reduce damage to the kidneys.
Thank you very much. Okay, thank you.
Thank you. I'm used to it, happy all day.
هيبوكريت اللي هو ابو الطب ما فينا ما نذكره، ما بعرف اذا بعدهم لهلا يبقوا الحكمه بس يتخرجوا بعدهم لهلا 400 سنه قبل الميلاد حكيم مديري بيعرفوا بطلوا عادي قديمه بس
كثير قديمه. عيب الاسود ابيض.
بس من اهم اقواله بالطب هلا بيعتمدوا قصص عنه يعني عنده اقوال كل شخص لديه طبيب بداخله علينا فقط مساعدته في عمله. قوة الشفاء الطبيعية داخل كل واحد منا هي أعظم قوة في التعافي. عصير التعافي يعني كثير بيحكي كمان هيبوكرات حكى يجب أن يكون طعامنا هو دواؤنا، ويجب أن يكون دواؤنا هو طعامنا، ولكن أن تأكل وأنت مريض هو تغذية مرضك. هو أحد الأخبار من 400 سنة قبل الميلاد.
بعدهم ماشيين لهلا.
بعدهم لهلا ماشيين. بس ما عم بيحكوا
راحت السنة كلها يعني.
لحظة صغيرة قبل ما تفكروا بدنا نشكركم جميعا بهالندوة الطبية، وبدنا نشكر دكتور غسان. ان شاء الله تكونوا استمتعتوا واستفدتوا واخذتوا معكم زوادي على بيتكم علميه وطبيه وتفيدوا المحبين حواليكم لحتى نحافظ على سلامه قلبكم. وشكرا جزيلا لكم.
ما حسيت شيء عليكم. بس الليلة هون تعلمنا فكرة جديدة ما بنعرفها من هالايفنت هيدا، وطلعنا هون وقدرنا خلصنا شخص واحد بنكون حققنا بعضنا البعض، حققنا اللي من اجله جينا عليه الليل. بقى باسمي واسم الجامعه اللبنانيه نتشكر الدكتور، نتشكر وجودكم، نتشكر سعاده الناس، نتشكركم كلكم بكل اهلا وسهلا وعلى بروشيت.